Hi there, Dr. Shelby here at Evolve Chiropractic in Woodstock, letting you in on a little insight or what to expect on your second day here or your day 2 at Evolve Chiropractic. So you just got done with your day 1, you had scheduled your second appointment, and you're coming in to learn all the information about what we discovered on your first appointment there. So if you remember back to your first appointment, you had x-rays taken, you had posture pictures taken, and you had a lot of orthopedic testing done that day. So when you come back for your next appointment, you will be again greeted by our front desk staff, and they will often have you just take a seat and wait for the doctor so they can come back and grab us. When they do that, we will come up, we'll grab you, and we'll take you into a separate room where we will be able to show you everything and talk about our care plan. So starting off, we will show you your posture pictures. Those posture pictures, we're looking at a few different things, but ideally what we're wanting to see is the difference between where your body should be in space, or the plumb line that's green on the posture pictures, and where your body currently is, oftentimes the red line you'll see on the posture pictures there. Sometimes we talk about effective head weight, if that's pertinent to the information. Sometimes we're talking about the different plot points, whether it's where your ear is compared to your shoulder, or where your shoulders are lined up or not lined up. From there, we will talk about your x-rays. Again, looking at what a healthy, normal spine looks like compared to what your spine currently looks like, as well as telling you a little bit more information about what this could lead to if left uncorrected. From there, we'll talk more about care plans and what that looks like for you. Oftentimes, when you come into our office, your body's already in pain and it's already in crisis mode. So that means we have to take your body out of crisis mode first as the first step before we can start correcting the problem. So oftentimes that starts off at 3 times a week for the first 4 weeks. It could be more depending on how much pain you're in and what symptoms you're experiencing, but that's where we start a lot of patients off. From there, we'll talk a little bit more about the overall care plan and how we're going to be addressing your problem here. Again, that oftentimes looks like getting adjusted, so those chiropractic adjustments, going through the rehab therapies on our therapy floor, as well as traction therapies as well. And we'll address those a little bit more in detail on that visit. From there, we'll also talk to you about care plan package options. So for a lot of patients, they like to go through insurance. And so with that, we'll take your insurance information. We'll have that verified after your first appointment. We'll have that information to show you on your second appointment, and we'll be able to show you your options with that. If you're not going through insurance, no worries. We do have cash options available, and they are very affordable as well. From there, we'll talk to you about what care can look like, as well as getting you adjusted that first day. If you decide to get adjusted that first day, we'll bring you on back to the bay, we'll get you adjusted, and again, we'll oftentimes recommend ice after the first couple of adjustments because you might be a little bit sore. It's like starting a new workout routine. You kind of expect to be sore there. From there, we'll take you up front and get you scheduled with our office manager for those first 12 visits, and then you'll be set to go. I hope this helps and gives you a little bit more insight on what to expect on your second day here.